and what are the diseases and how we can deal with it, what are the causes of the disease, how we can prevent it with our lifestyle is all what we discuss. In this series, today we have selected the topic, as you all know, PCOS, polycystic ovarian syndrome. So we'll get to know from Dr. Deepashree a lot of details about what is PCOS and what's the difference between PCOS and PCOD, some of the case studies where we have treated successfully, and what are the solutions we have. All those details we'll get in the next 30 to 40 minutes. Followed by that, we'll also have question and answer session. For all your questions, we'll be there to answer your queries. And I request all of you to mute yourself so that it becomes easy for Dr. Deepashree to give a presentation. And I'm sure you are all looking forward for this. Before I'll pass it on to Dr. Deepashree, I would like to briefly talk about her as well. She is a BNYS graduate from SDM College of Naturopathy and Yogic Sciences. She has a rich experience of 5 years now, and she has been working with me for the last 2 years and plus a little more. But before that, she has been a very good student, topper in her college, and she was working with Cancer Institute, HCG, in Bangalore for first 3 years, where she had extensive experience with how to deal with cancer and the psychology of behind cancer, and how yoga can help in managing the cancer symptoms along with acupuncture. So that's what her domain is. So I'll hand it over to her. She'll take you forward with her presentation. Thank you.
Thank you, sir. Thank you. So I think we are all ready to discuss about the natural healing solutions that we have for PCOD. Let me straight away start with my presentation. If you have any questions, any queries that you have, please post your questions in the chat box, and we will take those questions in the end and answer it for you. So let me just share my screen for the presentation today. So like Dr. Gurudat was saying, today the topic that we've discussed, or we have decided to discuss with all of you, is PCOS, polycystic ovarian syndrome. Why we have chosen this is probably the first question. We see almost 1 in every 10 women who are going through PCOS. It has brought in so much of morbidity, so much of affected quality of life, because a woman is going through PCOD. There's disturbance in her quality of life, in the family relationships, in her personal life, in achieving her personal goals. It is coming in between. It is hindering the process and hindering the quality of life. So we thought we will discuss today about PCOS. Most of the women here who are attending, the mothers who have their daughters going through PCOS, I'm sure you have faced a lot of questions from the society about being overweight or having acne, going through discomforts of PCOD, getting comments, getting expressions, showing, getting looks about why we are so fat, or why do we have acne, why are we eating, even though we are fat, why are we eating something that we like. So we go in through a lot when we are going through a PCOD, which is not visible outside. The manifestations are definitely visible, but what's happening inside is something we're not able to figure out and manage it properly. Do we really have to go through all of these comments and questions, or do we really have to go through the symptoms, discomfort, pain, about going through the phase of infertility because of PCOS? Do we really deserve it? No, right? So we have to take steps, effective steps in managing and in fighting PCOS. So today, our effort in doing this webinar is to create that awareness, pass on the information, and extend a helping hand in those who are looking out for, looking out for ways and methods to manage PCOS. So let us begin. Today, we're going to be basically understanding the normal ovarian function. If you have to understand what is disrupting it, we have to first understand what is normalcy. What is PCOS? What is the difference between PCOD and PCOS? We hear both the terms. So what is the difference between the two? What are the symptoms of PCOD? How does it present? What are the risk factors that PCOD can have in development? Why should it be addressed? What are the complications that it can develop into? And what are the natural healing solutions that we have for managing the same? So first, the normal ovarian function. Every woman has two ovaries, the right and the left ovary, and both these ovaries are the ones that release a developed and a matured egg every month, right? So the development of this egg, if you see this image here, you see what is called a primordial follicle, a primary follicle, and all that. So these follicles are present at birth for every woman. There are millions of follicles in each ovary, and every month, one of the follicle develops and matures into a Graafian follicle, or something that releases the egg outside or the ovum outside. Okay, so amongst so many follicles that are there, there's one that matures and that releases the egg. And once the egg is moved out of the ovary, the follicle disintegrates into what is called a corpus luteum. So this is what happens normally every month. So if 1 month there's a right ovary that is actively working on releasing the egg, the alternate month there's a left ovary that is working on releasing the egg. Most of the times it is the alternate ovaries that are functioning. Okay, so what happens in PCOD? There is this normal ovarian function. What is happening in PCOD is these follicles are filled with what is called a fluid. That's why it's called a cyst. So PCOS, poly, is multiple, cystic, these fluid-filled bags or fluid-filled follicles in the ovary. Okay, it has become a syndrome, PCOS syndrome, because it is a hormonal disorder. There's normal hormonal functions that are disrupted. So there's hormonal imbalance, and which is also leading to a lot of inflammatory condition in the body, low-grade inflammation that is constantly happening. And there is metabolic disruption. That's why there is weight gain. There's a lot of other complications that we're going to discuss that through PCOD it starts. That's why PCOD, which is a disorder, polycystic ovarian disease or a disorder, turning into a syndrome. One thing giving way to multiple other things that begin in the body, syndrome, is happening. Okay, so there is hormonal disruption that happens. If we might have heard, or we might have gone through these blood tests where they check the estrogen levels, progesterone levels, AMH levels, LH, FSH. These hormones all go into a chaotic state. There's low-grade inflammation that constantly happens within the reproductive system, within the ovaries, within the fallopian tube and the uterus, and also systemic low-grade inflammation that happens in PCOD. Along with that, because of the low-grade inflammation, because of affected or disrupted hormones, there's also metabolic functions that are disturbed. That's why a woman with PCOD tends to gain weight. And it is a cyclic connection. First, a PCOD can set in and women can start gaining weight, or a woman can be overweight or obese and can develop PCOD. Okay, so if we see this image here, we see that these multiple follicles that are filled with fluid. So when the follicles are filled with fluid, there is no egg that can develop and mature inside these follicles and can come out. That's why women with PCOD usually have anovulatory cycles. That means there is no ovulation that is happening, but the cycles are there, which are very irregular, which can get delayed to 45, 50 days with a lot of discomforts during the cycles. Right? That is why that's one of the major reasons or causes why women with PCOD find it hard to conceive. There's also infertility that comes along with PCOD. And women in fertile period these days, most of them, like I told you in the beginning, 1 in every 10 women are going through PCOD. So I think it's all our responsibility to fight against it and understand what can we do, right? So how do we recognize whether we have PCOD? Most of us are aware of this because it's been, you know, coming everywhere in the media. There are so many people who are trying to create awareness. So the symptoms of PCOD usually is the hair loss from the anterior hairline. So from the anterior hairline, the hair tends to fall off. Hair starts to become thin. And also there is body hair growth, hirsutism or male pattern of hair growth. The hair in the chin, around the umbilicus, the hair even in the hands and the legs tend to become very thick. So there is hirsutism, that is the male pattern of hair growth that is seen. There is pelvic pain during a menstrual cycle, during periods. Women tend to have a lot of pain and discomfort. Women with PCOD also have difficulty during the sexual intercourse as well. There is that even during the act also there's a lot of pain, pelvic pain that they go through. There is infertility, which is one of the major complications of PCOD. Like we discussed, women find it very hard to conceive because there's an ovulatory cycle. There's no ovulation that is happening on a regular basis, on a monthly basis. And that's why, in spite of trying hard and fast rules to conceive, they find it very difficult to do it. And also, there are a lot of support system that is gone down. If there's hormonal imbalance, if there is a lot of metabolic disruption, again, there is no support system for the body or for the ovarian functions to happen. So even here, again, conception is an issue. Overweight, like I said, women tend to gain weight with PCOD. And what is worse is not just gaining weight, but very difficult in losing weight. Once they start gaining weight, it becomes very difficult for women to lose weight. They do multiple things. They start gymming, they start exercises, they go into very strict diet restrictions. They do multiple things. They get into hormonal medications, course of medications that they have to take day in and day out. And everything that they do is not helping them bringing down their weight. Irregular periods. Because the normal ovarian function or the cyclic function that happens every month is disturbed, the hormones go into imbalance, and that's why periods are not regular. It is not for every 28, 30 days, but goes up to 45, 50 days. It can complicate to 3 months, 4 months, where women don't see bleeding at all. And they wait every month with a lot of stress. Oh, I'm not bleeding. There's 1 month that has passed. I'm popping up pills. I'm doing exercise. But still, there's no result that they see with these efforts that they're putting for PCOD. So periods become very irregular, and that itself can cause a lot of psychological stress. Fatigue. With so much of inflammation in the body, with so much of metabolic disruption in the body, women tend to have low energy states, especially in and around the cycles. And even for a lot of women throughout the cycle, throughout the month, they go through physical fatigue as well as mental lethargy. No mood to do anything. I don't want to really put energy in doing anything, not even things that I like. So there's lethargy, complete lethargy that sets in with PCOD. High testosterone levels. Testosterone is a male hormone which tends to increase in PCOD. There's also acne that a lot of women see with PCOD, acne that are also again cystic. That means very thick, very painful, sometimes pus filled. Most of the times comes around the cycle or around the ovulation time. And again, very difficult to get, um, you know, very difficult to solve or get out of the acne issue during PCOD. So these are one of few of the very commonest symptoms that we see. But there are a lot of women who do not have any of these symptoms, but the scan report shows that there are multiple cysts in the ovary. Some of the blood tests, like AMH levels, when they test, it shows either very high AMH levels or very low AMH levels in PCOD. Right. So even without these symptoms, some of the investigations can dig out the causative factors for the symptoms that we are facing. So what are the risk factors? Why a woman develops PCOD? Most of us who are probably going through PCOD might have heard from our parents saying, especially our mother saying, we did not have these issues during our age. In our generation, women would really not have these PCOD, thyroid issue, infertility, and all that. This is what we're hearing these days. It's become very prevalent these days. Why is it so? It is because of our irregular food habits, irregular lifestyle that we're leading. So let's understand what are the risk factors that we are going through day in and day out that is contributing for the development and worsening of PCOD. So genetic predisposition. I can be genetically predisposed to get PCOD. Doesn't mean if my family, say my mother or my maternal side, there's somebody who has PCOD, doesn't mean that I should definitely get PCOD. I can prevent it by my lifestyle. But there's a risk of me developing PCOD because there's a genetic history. So genetic predisposition is one of the risk factors. So most of us who are thinking, okay, if I'm already genetically predisposed, what can I do? What is it in my hands to do? Like I said, my lifestyle, my food habits can decide whether I develop PCOD or not. Psychological causes. Ineffective stress management is the main thing because each of us are going through stress in our everyday activity, be it in a profession, be it in a family, because of the disorders that we are going through, because of the health issues that we have, because of umpteen amount of responsibility that we have on our shoulders. There's a lot of expectations from each one of us. Women have to these days go to work and excel in work. They should be, with par with everybody else. So there's a lot of expectation there. There's also social responsibilities that women have. There's family responsibility that she has. And all of these are becoming very difficult at times for her to handle. And these psychological issues, the stress factors, mostly the intensity of the stress that we go through. There are probably a lot of people who say, I'm not stressed. I'm just working. I have people who can take care of the food and everything. I'm just working. I only have few very little things to handle, but still I've developed PCOD. There could be multiple factors, like the intensity of the stress. For example, if I'm supposed to work 8 hours a day, 8 hours a day, what is the intensity of focus that you have to put on something? What is the level of sympathetic arousal that is constantly there in your body can also result in hormonal disruption and development of PCOD. What happens is in women, these hormones are very, very sensitive. And that is why if there is any change that happens in our mental well-being, in the food that we eat, in the sleep patterns, they start becoming haywire. And that's why women tend to develop a lot of hormonal related disorders these days: hypothyroidism, PCOD, infertility, dysmenorrhea, menorrhagia. All of these are hormonal issues. Diabetes mellitus, again a hormonal issue. And all of this is because our hormones are very sensitive to the changes that is happening within and around us. There are physical causes. For example, lack of physical activity. If I am sitting from morning till evening for work, and afterwards, okay, I've worked for the entire day, I want to sit and relax. So I've been sitting the entire day. There's so much of stagnation. This stagnation can cause overweight, weight gain, and again develop PCOD. If I am not physically active at all, back then women were physically active throughout the day. Now our physical activity is narrowed down to 1 hour a day. Okay, 1 hour a day I'm gymming, 1 hour a day I'm doing yoga, 1 hour a day I'm going out for cycling or jogging. So if say we were physically active for 8 to 9 hours a day in whatever work that we did, now it is narrowed down to 1 hour. So this lack of physical activity can also lead to weight gain and development of PCOD, because a lot of women who are going through PCOD are trying so much. Every day I'm working out, 1 hour I'm making sure that I'm doing a lot of workout, but still they don't see any results. They don't see either weight reduction or hormonal balance that happens, because that 1 hour is not sufficient for the hours of stagnation that we're creating. There should be a balance. Food habits. If I am eating at irregular times, if I'm eating a lot of processed foods, sugars, refined carbohydrates, lot of dairy, lot of hormone injected food like substances, then I can these hormones in the food like substances can affect the hormones within. These dairy products can affect the hormones within. So that way, again, food is also contributing in metabolic disruption and hormonal imbalance. Environmental causes. The food, air, how the food is grown, how it is prepared, the air that we are breathing, the environment that we're living in. Most of it is not in our control. Some of it definitely yes, but most of it is not in our control. The amount of radiation exposure that we're having day in and day out, the kind of lifestyle attitude that is there these days. Everybody should eat. If somebody is not eating outside, if somebody is not going partying weekly once, that becomes like a taboo. Oh, you don't go party, you don't go drink, you don't go eat. So that becomes like, that's the attitude in the environment that's there. And again, that is one of the cause for development of PCOS. So what is happening? There is a cycle that happens in our body from the brain, that is the hypothalamus. The signals are passed to the pituitary gland, which is the master gland. And the master gland tells the ovaries to function in a certain way. So with these risk factors of food, of sleep, of stress, of the environmental causes, of the genetic predisposition, the cycle between the hypothalamus, pituitary, and the ovaries are disrupted. Okay, so that is the entire cycle of function is itself disrupted. So we cannot expect normal functioning to happen. Why should PCOD be addressed? PCOD is, or PCOS, like the syndrome, can develop into multiple complications if not addressed properly. What are the complications? Obesity is one of the very common complications that we have been seeing, right? Infertility, women find it hard to conceive. Gestational problems. Women who conceive with PCOD can have complications during pregnancy and childbirth. Development of type 2 diabetes mellitus. That's why most of the women who are going through PCOD are also put on metformin or also put on anti-diabetic medications, because there's insulin resistance that develops. Can develop hypothyroidism, which is like hypothyroidism can worsen PCOD, PCOD can worsen thyroid functions. Metabolic syndrome, dyslipidemia, development of dyslipidemia, hypertension, and diabetes together. Cardiovascular diseases. There are a lot of studies that are observing the study that I've quoted here, complications and challenges associated with PCOD, also says that there's a lot of cardiovascular risk that is developed, and women tend to have hypertension and other cardiac issues like a lot of early cardiac arrest that is seen in women. Women are most of the times protected until menopause for their cardiac functions. But these days, we are not seeing this feature. Women are also at equal risk of developing cardiac issues because they're going through PCOS. breast and endometrial cancer, because these cancers are hormone positive cancers mostly, and PCOD with a hormonal imbalance can lead to development of these cancers. Psychological implications, because we are going through these many symptoms, because we have to face these many questions and comments, because it is disrupting our quality of life in every step that we want to take, be it profession, be it our personal life, be it our relationships. It is affecting every aspect of the life, and hormones themselves can affect our mind a lot. And that is why psychological implications, development of anxiety, going into deep depressions are very much possible with PCOD. Again, with naming all of these complications, I'm not here to scare anybody. Okay, what do I do now? No, this should somewhere motivate you all to fight PCOD in a better way. I should make sure that I don't enter any of these complications. I also make sure that I help peer groups, I help people around me to become aware of what is happening. So let us understand what are the solutions that we have for PCOD. So how do we resolve PCOD? The first thing is prevention. With proper lifestyle, proper stress management techniques, rather than stress management, we should also work on how happy can we. If there is stress and I manage it, that's one part. Can I also experience joy and happiness? That's the second part, right? So that is also something that we have to work on. We have to work on the food habits. We have to work on the food patterns that we follow, sleep patterns that we follow. So with this, with early recognition, if we can prevent PCOD, that's the best way to manage it. The second step is, like we discussed, the early recognition. Recognize the symptoms that you have. Seek help, seek medical help when required, when you recognize these symptoms, and at the same time also start working on your lifestyle. Lifestyle correction. Lifestyle correction becomes a very prominent thing in the management of PCOD. If you go to any doctor, the first thing that they will advise is correct your lifestyle. Eat proper food, eat at proper times, follow your regular sleep patterns, exercise regularly. Make sure that you're not stagnant in one place. You do not have a sedentary lifestyle. There are also a lot of therapies. There are hormonal therapies. There are alternative therapies that are helpful in managing PCOD. Let's get into the therapies soon. And secondary prevention. I tried for 1 year. I do therapies. I do lifestyle correction. My PCOD is resolved. I see the cysts come down, the size of the cysts coming down, the number of the cysts coming down. My periods become irregular. My periods become regular. So all of this you see in the end of 1 year with all the efforts that you put, then you're like, okay, now everything is settled. And then if you let loose, you can again develop PCOD. So secondary prevention is also very, very important, because just 2 days back, there was a lady who came in and who said, I have been having PCOD on and off. I do something, it resolves, it again comes back, it resolves, it again comes back. So secondary prevention is also something that you should aim at. So, like I said, the lifestyle correction becomes common in all of these steps, be it prevention, be it with early recognition. Once you recognize, you start correcting your lifestyle. The therapies, when you're doing your therapies, also lifestyle is a major contributing factor. Even for secondary prevention, lifestyle correction is a major contributing factor. Therapies, what are the natural healing solutions that are available? There is naturopathy. Naturopathy is nothing but staying in tune to nature's principle. If you go through our YouTube channel, there are a lot of videos that we have made to bring in awareness about what is the natural lifestyle that we should have, what is the routine that we should follow, what are the food habits that we should follow. So please go ahead and watch them to understand what is naturopathy, what is natural lifestyle. If I am following nature's principle, if I am in tune with nature's principle, if I wake up with sunrise, if I end my activities with sunset, if I give my rest, if I allow my body to rest and then go to sleep? Am I eating at regular timings? Am I following my hunger pattern? Am I drinking enough water? Am I eating natural foods or am I eating food like substances? Am I in tune with nature is what we have to understand. Please observe all the other organisms around you, of course, not the domesticated animals, but the natural wild animals around you. They're so much in tune with nature's principle, but we are not. So if we understand our nature, if we observe our nature and can be in tune, that's naturopathy. Acupuncture is very, very promising, very effective therapy. We will get in a little while to understand in detail about acupuncture. There is yoga therapy. Again, we will understand about yoga therapy in detail. There are a lot of other alternative therapies, and there's surgery, there's medication also for managing the PCOD and PCOS. There's Ayurveda, there's homeopathy. All of these systems, when in integration worked properly, can give you very beautiful results. So acupuncture. Acupuncture is a energy medicine. So it balances out on your energies. It works on your energies. When you're going through acupuncture, what it basically does is it clears the dampness. Cyst is a fluid, right? Fluid, something that's damp within the body. So if my body is damp, fluid filled, acupuncture helps in clearing that dampness and the stagnation that is going on because of the lifestyle that we live. It regulates the menstrual cycles by bringing the hormonal balance. It regulates the menstrual cycle. You can see once you start taking acupuncture, you see that your cycles become regular. It tends to happen at every 28-30 days. It reduces the inflammatory functions, inflammatory activity that is happening in the reproductive system and in the systemic organs. It improves the metabolic functions. It improves the digestion. It improves your appetite. It brings down the craving that women in PCOD go through. Reduces the insulin resistance. There's insulin resistance that's developed, and that's why diabetes is something that women PCOD develop. And acupuncture is very, very effective in bringing down insulin resistance. And more so, acupuncture as a therapy itself is very relaxing in nature. Those 30-40 minutes of therapy that you go through itself is very relaxing, and the after effects of the session are also very, very relaxing in nature. So there are a lot of scientific studies, published literatures that support acupuncture being very, very effective in the management of PCOD. I urge all of you to go through it, understand it, and then start with these therapies if you want effective management for PCOD. Yoga therapy, again, is a very holistic therapy. Once you start practicing yoga, it works on the mind, it works on the body, works on your energy, it works on your intellect, it works on every aspect of your life, and it starts harmonizing it. It starts bringing everything into balance. So of course, with everything coming into balance, your cycles also tend to regularize, your weight tends to come down, the mind gets relaxed. There's a lot of metabolic, physiological changes that happen within the body. And again, for yoga, there are a lot of supportive studies and literatures that are there. In our clinic itself, we have seen a lot of women who come with PCOD, who come with issues of infertility, who have been practicing yoga, who have been taking acupuncture, and are seeing very, very promising results in bringing down their cysts, bringing down the number of cysts, the size, regulating the menstrual cycles. So there are a lot of evidence, a lot of proof, a lot of confidence that we have in our system with which we can help you in the management of PCOD. So what are the tips that I can give you to manage PCOD? What you can do at home is, first thing, try not to disturb your circadian rhythm. There is a day and night cycle that happens in your body. Try not to disturb it. The moment you disturb it, your body is working with a lot of load, with a lot of pressure. So for this amount of pressure that you give your body and mind, there must be certain disruptions that will happen. So if you try and balance your circadian rhythm, if you do not disturb it, if you allow your body to rest as the day ends, and if you're active physically and mentally through the day without, you know, going into excessive or anxious or intense focusing in mental activity or very reduced physical activity. That's what is happening these days, right? So if we can balance out on circadian rhythm, that's the day and night cycle of our body, it will help in great deal in management of PCOD. Exercise regularly. I am a yoga doctor, so I can say practice yoga, but there people probably who do not like practicing yoga, right? Yoga is, of course, a holistic medicine. I would always recommend yoga. But what if somebody doesn't like yoga? I cannot force them to do it. So exercise regularly. It could be swimming, it could be cycling, it could be a regular walks that you go on to. It could be playing badminton, involving yourselves in activities that make you physically fresh. That itself is very, very important. Avoid processed foods, mainly the refined carbs. See, these days our mental activity is high, right? We have to always focus on something and do give results by the end of the day. So the amount of the sugar that our brain requires, the amount of sugar that the brain requires is very, very high. So we have these cravings. We want to eat something that gives us instant energy, instant glucose, instant sugar to the body. So we are indulging in eating a lot of refined carbs, the processed foods. So the moment we start avoiding it, the moment we start eating holistic food that are very natural, that are very seasonal and locally grown, we'll see a lot of changes in the metabolism. We will see changes in the hormones. We will ourselves start feeling better and energetic. Avoid damp and cold foods. Damp as in a lot of raw vegetables, lot of cold foods, refrigerated curds, ice creams. Of course, ice creams are very yummy, but the more ice creams you take, the more you're aiding the development of PCOD and worsening of it. Cold foods, taking a lot of cold foods can also affect, because it is cyst, it is a fluid filled baggage, right? So more of dampness and more of cold that adds in our food can worsen the formation of cysts. It can make the cysts grow bigger. It can increase the number of cysts. Manage your stressors effectively. Rather, like I told before, start also experiencing joy, start also experiencing peace of mind. If, say, I'm stressed for 5 minutes in a day, which is very less, I know, arbitrarily, if I'm stressed for 5 minutes, it's not that I'm only relaxed for 5 minutes. It's also important that I'm happy for 5 minutes, the complete opposite of it. So start managing your stressors effectively. I cannot say avoid them. Avoiding stresses probably is escapism these days, because we have a lot of expectations on us. So manage them effectively. Stay away as much as possible from gadgets. You can all do the experiment. The month that you're away from, most of us might have experienced, when we go into resorts or when we go into places where we do not have any signals, we cannot call anybody, nobody can call us, we do not have work, we're very happy, we're very stress-free. We also feel very light and contented. But we are every day, day in and day out, loading our body and mind with a lot of gadget work, a lot of focusing, a lot of radiation exposure that is happening. So as much as possible, stay away from gadgets. And I can write it and give it to you. That will definitely help in regularizing your system. Pursue your hobbies. Most of us have forgotten about what hobbies we've had as a child. We were interested in a lot of things. We were seeking happiness by involving ourselves in these hobbies. But with work, with so much of expectations on us, we are literally not giving time for hobbies. We are only working on something that will give us instant relaxation. Okay, I'm going to go drink a coffee. I'm going to go out for a smoke. That, kind of relax me a bit. That's all we are doing. The moment you start energizing yourselves, pumping yourselves with happy hormones, pursuing your hobbies, you will see a lot of change in your health as well. So let us take this pledge to fight polycystic ovarian syndrome, not only because we are facing comments from the society, we are getting those expressions of, oh, how fat she is, oh, look at her, she's fat but still she's eating, look at her, she's, she has a lot of acne, look at her, she's going through that pain. Oh, we've been facing a lot of comments, but should we fight PCOS just because we're fighting these comments? No, not just because of that. Not also because we're going through these symptoms for our own self. Okay, I don't want to go through this pain and discomfort. Let me fight PCOS. Not also only because of that. That could be one of the reasons. Not also because PCOD can aid development of so many complications. Like I said, the cancers and metabolic disease and that and this. Not only because of that. Let's not get scared. Oh, what if I get cancer and start fighting PCOS now? No. Let us do it because health is our right and at the same time our duty. So the minute we start working on our health, our physical well-being and mental well-being, we can effectively deliver all the expectations that we have upon us. The moment health is compromised, it's a chain reaction. Our ability to focus, our physical energy, mental energy, our social involvement, everything comes down. So health is our right, is what we have to experience every day, and is also our duty to take care of it. So let's fight PCOS for this reason. Thank you for patient listening. Thank you for the time that you've given here to understand the development, understand the complications, understand the solutions for PCOD. If you have any questions, please post those questions in the chat box. And if you want a detailed consultation, please contact us in these numbers and the mail that is there in the slide, and we'll be able to help you on that. Yes. So if there are any questions, I think we can start with those questions.
Yes, Dr. Deepashree. It was a beautiful presentation.
Thank you.
All the points were clear and very good. And it's no attachments of that. There's nothing extra. It was all fine. We have one question, and also we have posted the link of our YouTube channel for any one of you to view it in course of time. This webinar also, a recording of that will be we shall upload it on our YouTube channel very shortly after today's session in a couple of days. In the meantime, we have one question by Ms. Uma Agarwal. What is the size of the cyst for the doctor to declare as PCOS in a scanned report?
Okay. So when you get scanning done, you can either see a single large cyst or multiple small cysts. Okay. Most of the time, these cysts are at a size of 5 to 10 mm. Okay. So when they can go as bad as 10 to 12 centimeters also. Recently, there was a patient who came and told there was a large 12 centimeter cyst that I got operated and removed from my body. So your doctor, when you get the scanning done, they can see one large cyst in either of the ovaries or both the ovaries, or they can see multiple small cysts in the ovary. Okay, and there's no standard size for these cysts. It can vary from 5 to 8 mm. It can go up to multiple centimeters also, and it depends on the severity of the cysts that are there as well. Okay, so it is not about the number, but it's about how many cysts are there, or if there's just one cyst, how large it is, and how complex it has made the normal ovarian functions to happen.
That's nice. That's appropriate. Very nice. We have the next question from Sujata Krishna. I am undergoing light flow from few months. Any remedy for the same?
Okay. So when you say light flow, it has a lot of other questions that I have to add for it as well. What is your age? When you say light flow, what is also the color of it? What is the interval between the cycles? So it's just with one factor of light flow, we cannot say these are the things that, okay, do this, 1, 2, 3, and 4, and that'll help you. Most of the times, one common thing that we see when women go through reduced bleeding or light flow is in two situations. One, if there is deficiency, if there's lack of nourishment, okay, if there is lack of nourishment through food, lack of psychological nourishment, lack of physical nourishment, that can reduce your flow. If you're having an early menopause or if you're going through normal menopause phase, that's also when you have reduced flow. Okay, so if women in their early ages are going through reduced flow, there could be multiple factors that are involved. It is mainly deficiency that we see, and that deficiency needs to be boosted by nourishing through food, by regularizing the physical activity, and therapies are definitely necessary for you to improve the flow. There was one lady who was going through menopause, who was in her perimenopausal stage, and she was having very irregular cycles. Of course, during menopause, women go through irregularity in the cycles. She did 1 month of acupuncture, and that cycle, she had regular bleeding. She had 3 days of bleeding, which she had not seen in the past so many months because she was going through menopause. So acupuncture, when you take, it can help, it can nourish your system so beautifully by improving the circulation. Like I said, bringing down the inflammation, it will help you improve your the quantity of the blood flow that you expect during your cycle. And most of the times these days, going through very restricted diets, a lot of people who say, okay, I'm not eating so many things because I have gained weight, I have to lose weight. So you're, along with going on that diet, you're also malnourishing yourselves. You should follow a holistic diet pattern that will help you with nourishing your body. If you start malnourishing your body and giving it a lot of refined, instant energy delivering foods, then also you can enter into a phase where the flow becomes reduced and also the color becomes very pale, and you also tend to end up with fatigue and a lot of fatigue, a lot of pain, a lot of cramps, a lot of leg pain, lot of kind of tired feeling in the legs and the back. So these are also associated symptoms.
We have the next question from Mr. Muralidhar Rao. Why is this so common in youngsters these days? Does PCOS lead not to have periods? That means amenorrhea. And the following question is, does PCOS cause cancer?
Okay. So women, young ladies, young women these days are going through PCOD because right from their childhood, right from the age they enter uh, their cycles, or the puberty that is called, there is lot of because of this social expectations. A woman should always be thin, she should always fit into that size. There's no you should always be fair, you should always have a very shining hair. So there's a lot of expectations, that's one thing. So what happens is, from then on, there's a lot of malnourishment happening because I don't want to eat sweets, I don't want to eat ghee, I don't want to eat these vegetables and all that. I know all of these are really probably help, probably will lead to overweight and weight gain. So I'm going to avoid it. So youngsters, one thing, they are malnourished for whatever reasons. One of the reasons is, like I said, they are trying to uh, meet the expectation of the society. Also, because of their busy schedule that they are going through, lot of work, lot of studies, lot of gadget exposure, lot of spending time with these phone. There's what is it, there's laptop, uh, there's so many gadgets, right? I really can't name them. With all of this sitting amidst all of these gadgets, with so much of responsibilities and expectations that we have to meet, we are not following a proper lifestyle, and that's why young women are also going through this, very commonly going through PCOD. And like I said, the risk factors that we discussed, we are all exposed to those risk factors, and we are all not really fighting these risk factors. And of course, early puberty is also there. Early, right from the puberty, they develop a PCOD. It's because of the nourishment, it's because of the lifestyle that we are leading these days. From the second question that you asked, can it cause cancers? Yes, there is a very unfortunate complication of PCOD, that it can lead to development of an ovarian cancer or an endometrial cancer or breast cancer, because all of these three cancers are hormone sensitive. These organs are hormone sensitive, and cancers can also be hormone positive cancers. So there is a chance that women can develop cancer if not taken care in the early stages.
I think that's all we have today in terms of questions. If still someone is having any questions, we are open to take questions. We have another couple of minutes to close the webinar. All the points were very clear, and I am sure it was all answered appropriately. If anyone is having any questions, please post it. And we expect you to all look forward for the next webinar next month on the second Saturday or first Saturday, depending on our schedules. The same, we'll come up with another new topic, and I'll be presenting the same in the next month. At times, we also invite few guest doctors who will also share their experience and their expertise on a particular subject. One of the recent ones in a couple of months we had about cancer. We plan to have infertility specialist also to come over in the next couple of months based on his schedule to discuss about infertility and the modern aspect of it and therapies. And we'll also talk about traditional aspects as well. It looks like we don't have any more questions. Thank you so much for taking off your time, spending time with us, patiently hearing and understanding the information about all this PCOS, the risk factors, the possible therapies which are there. So I'm sure it will all help. Try to spread the message to who and all in your circle who are suffering from this so that they can get help. And also you can watch our recording of the same very soon on our YouTube channel. Subscribe to our YouTube channel, Anandamaya Wellness Center. We have more than 60 to 70 videos on several different health topics and also preventive aspects. Every week we post one. We request you to share among your friends, peers, and relatives. The motto is, as Dr. Deepashree mentioned, to spread the right information about health and disease and what are all the options we have. Thank you so much once again. We'll see you soon in the next webinar. Thank you.